Hi, I'm Larry Mendte. Welcome to Jersey Matters. On this week's show, health experts are concerned about a twindemic this fall, a resurgence of COVID-19 coupled with a bad flu season. State epidemiologist Dr. Christina Tan tells us the one thing people can do to protect themselves. Long lines at the MVC, and the chief administrator is grilled in Trenton at legislative hearings. We'll talk with the chief, Sue Fulton, about those hearings. It has been a year since Dulce Maria Alaves was abducted. We get an update on the investigation from the Cumberland County prosecutor. And we'll hear from 9/11 widows who would like us to remember what happened on that infamous day all year long. But first, my interview with Dr. Christina Tan, New Jersey state epidemiologist. Thanks so much for making some time for us. I know this is a busy time for you. What is your biggest concern as we enter the fall?
We are concerned that we're entering flu season right now as we are embarking on reopening after the COVID pandemic. So because of that, we're in the midst of trying to prepare for making sure that we try to minimize the impact of flu as we enter respiratory virus season.
And the way you mitigate that is a flu shot, right?
Yeah, the flu shot is one of the best tools that we have right now to prevent flu infection. This is the time, September through the end of October is the optimal time to be getting the flu vaccine, because it takes about 2 weeks for you to get antibodies, to get immunity from the flu vaccine.
The coronavirus is sort of like the flu, right? I mean, it spreads much the same way. So the same precautions you would take to not get COVID-19 are the same precautions you'd take not to get the flu, except there's no vaccine.
Yeah, that's right. The good news is that we're very well practiced in social distancing, in wearing a mask, ensuring that you're washing your hands, making sure that you try not to touch your eyes and your nose and your mouth to introduce potentially infected droplets that could potentially infect you. So all the things that we are doing right now to prevent COVID infection are good for preventing influenza as well as other respiratory viruses that are circulating at this time of the year.
Dr. Herb Conaway, who is also an assemblyman, has a bill right now, and he wants to mandate that there can be religious exceptions, but he wants to mandate that all children get the flu shot, just like any other vaccine that they have to get to go back to school. I know you don't want to get involved in politics, but is that a good idea?
Right now we currently have a mandate for flu vaccination for our pre-K and our child care centers. That is so important right now because, the kids, aside from protecting the kids who are potentially at risk for complications for influenza, protects all their caregivers, it protects the parents, the grandparents. Our department completely promotes, trying, to encourage vaccination among all age groups in general.
I would imagine that there's going to be some panic in the flu, about the flu in the fall, because the symptoms are so similar to the coronavirus that people are going to get the flu, think they get the coronavirus, and that could really tax the medical community and our medical facilities. Is that a concern, and is that being prepared for?
We certainly are concerned about the overlap of symptoms between COVID-19 and influenza, because a lot of the symptoms are very similar. People can have very mild illness. A lot of people will have the same symptoms like fever, cough, shortness of breath, muscle aches, weakness, headaches. But there's certainly some considerations in terms of differences between influenza and COVID-19. As mentioned, we do have a vaccine for influenza, so that's why getting the flu vaccine is really important so that you can try to minimize the potential of your getting influenza. So it might be, it might potentially decrease the burden on our healthcare system. We know every single year that flu impacts the United States by huge magnitude. So for example, for this last flu season during the last year or so, we definitely know that we have seen, up to about 56 million flu cases. We know that there are roughly about 26 million visits to the physician's office as a result of flu. We know that there's roughly, up to 700,000 hospitalizations associated with flu and up to 60,000 deaths associated with flu. So anything we can do to minimize that burden to the healthcare system, will help in the event that we actually see a surge in COVID cases like we saw in the spring, so we can reserve those medical resources for that circumstance.
And there has to be an expectation in a rise in COVID cases because more people are going inside, more things are opening, and kids are going back to school. So that I'm assuming you're already preparing for and knowing that's going to happen.
Yeah, we're definitely preparing for the prospect of a potential increase in cases of COVID. But, we know a lot. We've learned a lot during the last several months about what we need to do. Even though we don't have a vaccine, we do have other tools to try to mitigate.
It seems like the death rate has gone down across the country, too. Is that because treatment's gotten better?
Well, currently there's no FDA-approved treatment for COVID-19. Generally, the care for COVID illness is supportive care. So you treat the fever, you make sure you stay hydrated, support any other, and to treat any symptoms that individuals might have. The issue might be that, we're starting to see a shift in illnesses occurring among younger populations. And among these younger populations, individuals who are younger, healthier, tend not to have more serious complications associated with COVID. As we saw earlier in the pandemic when COVID was impacting people who are in older populations, and who might have underlying medical conditions that might put them at risk for more serious illnesses.
Well, the number one thing people take away from this entire interview is go out and get your flu shot as soon as it's available, as soon as you can get it. Let me just ask you one last question. I know this will not be your decision, but I know you would also have some say in it. Is there a scenario, is there a number of cases or a number of deaths in New Jersey where things get shut down again, where they recommend taking more drastic action than they're taking right now?
Just like what we did during the past winter and spring when we were seeing the rise of COVID-19 cases, we were monitoring a lot of different metrics. Not only were we looking at the numbers of cases, the percent positive of individuals in the population, but we were very mindful of the impact on healthcare systems, monitoring the burden of illnesses, hospitalizations, intensive care unit use, ventilator use, in the healthcare system. And it's a combination of looking at all those different metrics that help determine, what are some of the next steps as far as some policy decisions.
So it sounds to me from what you just said that it is possible, but it would have to be the healthcare system being an overflow there. Is that the key metric?
Well, it's a combination of things. It's not only the healthcare system, but also the impact on the community at large. If you have a large number of essential workers or people who work in the community who are out sick, that certainly impacts our ability to function in our state as well as throughout the country. So that's why we look at that combination. We look at, how is healthcare impacted as well as, what is the burden in the general community and the state.
Dr. Tan, thank you so much for your time. We talk about heroes and all of this, and we talk about the frontline workers, but certainly medical professionals and epidemiologists, we're learning to appreciate them more than ever. So thank you for what you're doing. Thank you for your time.
Thank you so much.
Dr. Christina Tan, state epidemiologist. Up next on Jersey Matters, the director of the MVC, Sue Fulton, and her first interview since being grilled in Trenton about long lines at MVC centers. That's next.